Good afternoon to the Sunday afternoon briefing at St. Clair County EMA, where I welcome back Chairman Mark Kern. And Sam, hope you enjoyed your little day off yesterday.
I did. Thank you. It was great. The weather was great.
Well deserved. Both
Oh,
of
thank
us.
you. Happy to be back, though.
Yes.
So as of today, 11,209 tests have been performed on St. Clair County residents, with 1,626 positive test results, which is an increase of 16 from yesterday, and that does include both men and women from their 50s to their 70s. We are at 9,507 negative test results, with 76 results that are still pending. And unfortunately, we have a new number for the deaths that we are reporting. We are reporting 2 additional deaths for St. Clair County, which does bring our total up to 126. The first, a male in his 90s, and the second, a female in her 100s, both who did have underlying health conditions. And as always, our condolences go out to their families. For those who have completed the required IDPH 14-day quarantine, we are at 1,106. For state totals, we are at 1,190,985 that have been tested, with 132,543 positive test results, which is an increase of 672 from yesterday. And for the state, we are reporting 6,308 deaths, which is an increase of 19 from yesterday. For our hospitalization numbers, and these are for hospitals that are in St. Clair County, currently 49 patients are admitted due to COVID-related reasons, and 3 of those patients are currently on ventilators. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Atrium of Belleville has 2 cases and no deaths. Bria of Belleville has 48 cases and 6 deaths. Bria of Cahokia has 23 cases and 2 deaths. Caritas Family Solutions in Belleville has 12 cases and no deaths. Caseyville Nursing and Rehab has 3 cases and no deaths. Cedarhurst of Shiloh currently has 12 cases and no deaths. Cedar Ridge of Lebanon has 58 cases and 5 deaths. Colonnade Senior Living in O'Fallon currently has 6 cases and no deaths. Four Fountains in Belleville has 104 cases with 27 deaths. Help at Home in Belleville has 2 cases and no deaths. Help at Home in O'Fallon has 5 cases with no deaths. Knollwood Retirement Center in Caseyville has 8 cases and 1 death. Lebanon Care Center in Lebanon has 54 cases and 10 deaths. Memorial Care Center in Belleville has 44 cases and 5 deaths. New Athens Home for the Aged currently has 55 cases and 7 deaths. St. Paul's Home in Belleville has 45 cases and 14 deaths. Swansea Rehab and Care Center has 29 cases and 4 deaths. And TDL Incorporated in Belleville has 4 cases and no deaths. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. So we noted that last week 1,936 people got tested for COVID. That's important that those numbers are up like that. And so we appreciate everybody getting out there and getting their tests done to help us try to figure out how to isolate this virus and make sure that it doesn't spread. At this time, we'll move into the zip code reports for today. In 62059, we remain at 7. And remember, if you don't hear your zip code, it doesn't mean that you don't have a COVID positive in your particular zip code. What it means is that number hasn't risen to the number above 5 yet. In 62201, we went up by 3 today to 41. In 62203, we remain the same at 48. In 62204, we remain the same at 56. In 62205, we went up 1 today to 65. And in 62206, we went up by 3 to 141. In 62207, we also went up by 3 to 96. And in 62208, we went up by 1 to 86. In 62220, we remain the same today at 154. In 62221, we went up by 2 to 135. In 62223, we remained the same at 63. 62226 went up by 3 again today to 175. In 62232, we remain the same at 29. 62239 remains the same at 15. And 62243 remains the same at 8. In 62254, we saw an increase of 6 today, and that'll take us to 68. 62255 remains the same at 6, and 62257 remains the same at 11. 62258 also is static at 17. 62260 remains the same at 13, and 62264 remains the same at 51. 62269 also remains the same at 90, and 62285 went up by 1 today to 19. So we'll turn it over to Herb.
Thank you, Chairman. Today is Sunday, our day that we do question and answers. We're joined again with Assistant Director from EMA, Brian Whitaker, who will read those questions that come in, and we thank everybody who submitted those questions and comments, and we'll try to get you the answer. If we don't have it here today, we will research it and get you what we can. So, Brian, thank you.
Okay. We'll start with Sam with some health department questions, as those always seem to be popular during the Sunday briefing. The first one is, my mother tested positive, asymptomatic, and my stepdad tested negative. We've heard of false negative results, but is it possible to have a false positive results?
So none of the tests that we are using in the county are 100% accurate. I mean, there's always a possibility of, there being something wrong with the sample. But, there always could be a possibility of a false positive or a false negative test result. But, that's why we work with the facilities as closely as we do. So if there were any issue with a specific test, they would notify us, and, we could take the steps to fix that.
And in this particular situation, because of a positive test, and then even though he had a negative test because he's a close contact, both have the same quarantine requirement,
yes,
correct?
So because you have a positive in the household and someone else is also in the household, whether that be a spouse or a child or a roommate, they would still both be quarantined within the house.
Well, and Sam, one of the things could be maybe that false negative or positive. It could have been the way the test was done. I know when I had mine, if you don't do it properly, that could cause a bad reading. And
Exactly.
if you start, as we said, if you start getting symptoms, you still need to take caution, just like with anything.
Exactly. Even if you come back as a negative, but you are having symptoms, let's say a fever and a cough, you would still, outside of the COVID situation, we would still ask you, just as common good sense, to distance yourself from people, stay home until you're feeling well. That goes for anything besides COVID, the common cold, flu, just staying home until you're feeling better so you don't spread what you have to anyone else.
Very good.
Okay. Another one that came in says, if you go multiple times to be tested, are you counted more than once in the total counts?
So the answer is yes. Every test that is performed in St. Clair County is counted. So if an individual person gets tested 3 times, all 3 test results are recorded and counted.
Okay. And one more while we're here. What are the risks of trying on clothes in a store? Need to purchase items for the kids?
Sure. So many stores have policies regarding the use of their fitting rooms during, the issue of COVID-19. Because there are different opinions on how long COVID-19 could stay on the surface of a specific item. But the recommendation is always that when you bring something home, especially a clothing item, that you wash it if you can before wearing.
Okay. Chairman Kern, question came in that says, can you tell me as a Freeburg resident who is scared the virus isn't over, that our pool here in town has been allowed to open, and did the county allow it?
So the county doesn't license swimming pools. They're licensed by the state of Illinois Department of Public Health. As far as opening up a pool, pools are allowed to be open now for water aerobics, for swim practice, and that's part of the science that was put together that allowed us to move into phase 3 and hopefully will allow us to move into phase 4 on June 26th. I think what we are finding and what we're seeing is that Illinois now has some of the best numbers in the country. States that opened up too early didn't do the right thing. If you look at Florida, if you look at the numbers in Arizona, they are now seeing spikes that we were seeing way back in April. And that is because they didn't follow science, they didn't follow the guidelines, they opened up obviously too early, and that causes problems. What Illinois has said is that if you do go against the opening orders, and especially with a municipal asset like a swimming pool, that insurance is not going to be covered. And if there's any licenses that go along with that, you're putting the license of those facilities in jeopardy. Bottom line is, the doctors recommend that we wait until June 26th to open up. If people are going to be infected, what that's going to mean is that's going to mean that our doctors, our nurses, our hospitals are going to be working harder, because right now you already have 49 people, as we reported on the numbers, that are in the hospital right now in St. Clair County because of COVID. If pools open up and large gatherings are there, and they're in violation of the phasing orders, that might be a way that we'd see a spike again in this county, which is what we don't want. We want manageable numbers that eventually lead to a vaccine, which eventually gets us then to going back to normal. So I guess the recommendation is that you're right, COVID is not over, and if you are scared of catching it, certainly that is something that we all should be scared of, and we should remember that wearing a mask protects us, washing our hands, providing the social distancing, and following those rules that are set out by science will help us to get through this. That's the best thing, the best recommendation that I can give. And as far as letting anybody open up, the county is not in charge of swimming pools, and so that isn't our bailiwick. But we certainly provide guidance to all the municipalities, and that guidance says do not open up until the 26th.
Okay. Next one says, now that the state fair has canceled and with the expected phase 4 coming and no more than 50 people in groups, when will the Belleville Christmas market be decided on canceling for downtown?
So we're once again, this is another thing we're not in charge of. I would think, though, that with a market that opens up normally after Thanksgiving, they have time to be able to look at the numbers and see how they're rolling, to see whether a vaccine is online. All these things are going to really determine what happens in the fall and in the winter. So I would think all that is still under consideration, and I assume at a later date they will figure that out.
Okay, one more while we're here. The numbers in 62226 seem to grow every day. Is it because of long-term nursing homes, congregate facilities, or kind of a conglomeration of all of that?
So it is a conglomeration of all of that. All the numbers are reported in the zip code. People who live in a congregate care facility, their numbers are reported in that zip code. The people who work there, if they don't live in that zip code, their numbers would be reported to the zip codes where they live. So the long and short of it is, what's in your zip code is the people who reside in that zip code.
Okay, thank you. Sam, a couple more came in for you. It says, what has been or is the St. Clair County 7-day positivity percentage? Is it possible that it be included in the daily briefings? I've watched the briefings every day from day one, and thank you for the commitment that has been shown.
Well, you're certainly welcome. We're happy to be here through the COVID-19 and to update you guys as regularly as possible. The positivity number can be obtained daily by dividing the number of new COVID positive cases by the number of new tests. And along with that, the state displays the regional positivity rate on their website, which is the metric that will be used to open up the state.
Okay, very good. Next one here is putting back your thinking cap. On May 31st, Samantha said, we are urging everyone to get tested. If I didn't have any symptoms so far and I haven't been in contact with any infected person that I know of, should I get tested? And in the case of a negative result, how often should I get retested? And there's been some questions coming in today specifically along that, how often do I get retested?
Sure. Well, I can first of all tell you that our recommendation is that everyone be tested. Even if you limit the amount of times you leave your house for the grocery store run or the pharmacy run that you need to make, as we said, you can do everything right, and sometimes something can still happen. But if you think about deliveries that are made to your house, whether you have food delivered or grocery deliveries, there's still that possibility of something being transferred to you. In the regard of how many times you should be tested, there is no guidance on a set number of times you should be tested or how often you should get tested. But what we will tell you is, if you are out in the community doing errands, or you are one of those essential workers that is working every day, it's up to you to feel how many times you need to be tested. You will never be turned away from being tested, so if you feel that you would like to go once a week, you're certainly welcome to do so. You will never be turned away if you would like to be tested multiple times.
Okay. Next one says, is the nursing home total and town totals added together? For example, 62264 town total, is that the town total with the nursing home total added together, or just the towns? And I think the chairman kind of touched on this, but...
So when we report the numbers that we do for the number of cases for a long-term care facility, the number of cases that we report daily, that does include both staff and residents. However, the number of positives that we report daily are only those people that reside within the zip code, as Chairman Kern said. So any residents that reside at a specific long-term care facility would be reported within the zip code for the long-term care facility where it's located. But if they had staff members that lived outside of that zip code area or that jurisdiction, or in some cases they live outside of the county of St. Clair, they would then be reported to the zip code and the county where they reside.
Okay. Next one for you says, when Sam gives numbers each day for St. Clair County, do those numbers include Eastside Health Department numbers/data? If not, where can those be found? Thank you. Keep up the excellent work. You are appreciated.
Oh, well, again, thank you. And yes, the numbers that we do report daily do include Eastside Health District. We get updates from them every morning with their new positives, negatives, pending test results, and if they have any new deaths to report, and then we add those all in for a cumulative St. Clair County update number.
Okay, thank you very much. Chairman Kern, another one that's come in here that you might be able to give some guidance on is, who makes the decision if our area is ready for the next phase?
So that decision is based upon the numbers that we generate, or the numbers that are being generated by the activity that's going on in the county. So that includes number of hospitalizations, the amount of positives that are the people that get tested, and the positive ratio of COVID positive patients, the capacities in the hospitals. All these things are very certain. There is no wiggle room there. The numbers are what the numbers are, and they're determined by the state to see whether we're going to move into phase 4. We appear to do that. And it's no accident why we see Illinois' numbers now among some of the best in the country, where for a couple months there we were among the worst in the country. And it's because of following these metrics and doing the right things, opening up slowly, having this thing open up according to those numbers that we just talked about. That's the way we move into it. So it's really based upon numbers that are generated. And when we meet those numbers, we move into phase 4. And as of right now, we are headed towards the June 26th opening into phase 4.
Okay. The next one is, are the county or towns considering assisting those that have been out of work? I know several families that need food assistance, and if you locate a food pantry, they're running low.
So part of the dollars that we received from the federal government through the state of Illinois, part of it went to business assistance. Part of it is going to fund food pantries in the county. So I think there are 15 food pantries throughout the entire county that will be beneficiaries of that money. So the food pantries should have money. And I know there also have been a lot of private donations. People have really stepped forward in St. Clair County and in the region to make sure that people are fed and that the pantries have enough food to be able to distribute. Part of the issue early on was that a lot of the volunteers at the food pantries were elderly and some were immune compromised, and they hesitated to go out and work in those pantries at the time. I think those numbers are now improving, and from what we understand, the pantries are mostly up and running and are supplied.
Okay. And one more for you while we're here. It says, I know it's important not to let our guard down just because the numbers are trending down. Can you tell us if the numbers raise, what action will the county take? We don't want to go backwards, but if people don't do the right thing, could that be a possibility?
So one of the big things that we have done, and the reason why we've been here for almost 90 days, is education. And really we found that when we explained to people exactly the reason why when we started about washing your hands and saying happy birthday, which has now evolved into a number of other things, including asking people to wear masks and social distancing at 6 feet and all the other things we've talked about. When we explain it, people understand and then want to be a part of Team St. Clair. That's really what this has all been about, is that if everybody works together, we band together for a short period of time, we can get through this without having an inordinate amount of issues out there. Now, even with what we did, we have seen the death rate in St. Clair County be far higher than what we would like to see. And so we don't want to move backwards. I don't envision that, and I haven't seen any other states actually move backwards. If anything, they stop moving forward with the opening up, but I don't even see that happening. I see us following science, following the guidelines, and moving ahead slowly into phase 4, and then we'll see where it goes from there. Past phase 4 really relies on a vaccine or a cure for COVID, and that depends on, that's above my pay grade, and I think the pay grade of everyone else here, but we certainly are optimistic that will happen more sooner than later.
Thank you, sir. Director Simmons, a couple that have come in here that you might be able to provide some assistance on. First one says, why does it seem like there are different theories from multiple sources, yet you guys seem to have the most accurate information locally?
Well, that's because we're focused here locally. That's what we've decided from the get-go to do, is to make sure that our county residents receive that up-to-date information, and with the help of our partners from the health department, the hospitals, the long-term health care facilities, that cooperation has just grown over the last 3 months. As Sam said, getting those numbers together every day, looking at them, and then bringing them to our citizens, I think has made them understand that we're trying to give them that best information. And as the chairman said, the guests that we have had on talking about, social distancing, good personal hygiene, I think the more we have kept that out there in the forefront is what's really been beneficial and keeping them accurate.
Okay. As you talk about those guests, there's a question that came in that says, is there a reason why there hasn't been a doctor on lately to provide the updates?
Other than they may be busy, we stay in contact with the hospitals. We get reports from them daily. And I don't know how much more the physicians could come on here. We've had many of them on that has said the same thing. Back when the hospital capacity we were really watching. Now that those numbers are down, we want them to be focused on patients, and if we have to bring one back on, we can do that. But right now, we don't want to beat the dead horse to death. We just want everybody to understand that they're with us, the hospitals are with us through this pandemic, and if we need them, we'll get them.
Okay. And one more while we're here. The person writes, we apologize if this has been asked, but my wife and I just recently started following the daily briefings. Has the towns around our county been active in spreading the word on this pandemic? It's good from what we see being done here at the county level, but we're wondering about the smaller towns in the county.
Well, there's no apology needed. Yes, every county every town in the county has been informed. We conduct a weekly conference call with all of the communities, and we get a good attendance every Tuesday morning on that. All the mayors, I think, would tell you that we have shared every piece of information by virtue of either through email form or through those conference calls that we do. And I can tell you each and every one of those mayors, and I'm sure Chairman Kern will attest to this, has been on board with us, and anything that we've sent to them, if they've had questions, the swimming pool was a big issue. We kept giving them all that information, the splash pads, the churches issues. So yeah, every town in the county has been informed.
And the mayors and all the public officials have been under a lot of pressure to open up and to say, how come we can't do this or we can't do that? Other states are doing it. Why not us? And for the most part, the public officials have said, let's follow this plan. This is the plan that's put forth specifically in the state of Illinois to tell us how to keep our numbers in check, to keep our numbers as low as they possibly can be in the future. And that's really what has happened. I mean, everything that was predicted, the plan as was put into effect said, if we do these things, our numbers will gradually decrease to a number that will be manageable, and that really is the way that it has happened.
Well, and we've had several of the mayors join these briefings. The mayor Marissa, Shiloh, Muscuda, Fairview Heights, East St. Louis. There's not a one of those mayors would not sit here today and tell you, yeah, we want to open back up. We want our businesses open. We want to get back to normal. But they all said the same thing. We want to do it in a safe manner for our residents. And
and for the, if you look, if a city opens up any kind of anything that they own, and someone gets infected, they possibly become liable for becoming an attractive nuisance, for attracting people there that may come down with COVID. And so what we were told, we were informed that a lot of insurance carriers are saying that we're not going to cover a municipality or a governmental entity that doesn't follow the rules of the executive order. So not only are they putting the public health at risk, but they're putting their pocketbooks, or at least the taxpayers' pocketbooks, at risk.
Well, I think it's like you said, the plan, the scientific plan from the medical experts, not from us, or what we follow is like you said, if we do this is the results will come to it. And that's what we're doing, and that's why we're so close, just within a couple of weeks of phase 4, when more that will be lightened up, more of the things will be able to open up. So we've stayed focused, like you said, from day one. We were going to stay on course and follow the scientific part of it.
Thank you both. Sam, a couple more that have come in here. The next one says, when will all nursing homes allow visitors? When I've called one, the friend is in, they tell me they haven't been tested, and until that happens, visitors won't be allowed.
So I know a lot of people that have family members or friends that are in long-term care facilities are anxiously awaiting the day that they do allow visitors back into those facilities. As of right now, the guidelines from IDPH and the other regulatory agencies that are over long-term care facilities are still not allowing visitors in. When that guidance does change and they do start allowing visitors to come into long-term care facilities, we will certainly pass that information along in the briefing.
Well, Sam, and I want to just throw this out there too. The last couple of days we've talked quite a bit about the long-term healthcare facilities, which I think is a needed conversation to have. As recently as yesterday, there was just a couple of people on our briefing that still doesn't get the message that we have to have long-term healthcare facilities. We have loved ones that have to have places. In fact, I've reached out, and on Tuesday we'll have a special guest. One of the administrators from one of the long-term healthcares is going to come on and join us, and I'm sure she's going to have a story to tell what she's had to go through and what family members have had to go through, the phone calls that they've got at the long-term health care. Hey, can you tell me how my loved one's doing?
Sure.
So I'm anxious to hear what she has to say.
Well, and I've said it before, and I cannot stress it enough, that as a local health department, we have been extremely impressed with the lengths that these long-term care facilities have gone to, not only to protect the residents that call their facility home, but the staff members that work there. I mean, they have gone above and beyond the guidance that has been put out by the regulatory agencies that are over long-term care facilities, as well as IDPH. I mean, they've taken every step that they can to keep their staff and their residents as safe as they can.
Well, and there was one comment yesterday, individual wanting to know what we were doing to help the long-term healthcare facilities, that we weren't doing anything. And we all know that at the beginning there was shortage of gowns, there was shortage of masks, there was shortage of test kits. You had a stockpile of gowns and that got those long-term healthcare facilities through those crises until our representatives was able to help us. So it was an unfair comment, and a lot of the people on the briefings basically said, we've done everything we can, and you did at the health department. So
And not only with just PPE, if a facility did reach outbreak status, we had the ability to have a conference call with not only that facility and with us as a health department, but with IDPH and the individuals that specifically work with infection control in congregate living facilities. And we were able to have a united conference call to say, hey, as a facility, what are your biggest concerns? Perhaps bring some issues to the table that hadn't happened yet, but what we have seen in the past, to say, these are some things, safety measures you might want to put in place to hopefully eliminate any further issues. But, as a health department, if any long-term care facility has contacted us, we've done everything in our power to give them the help they've needed, whether that be staffing, whether that be the PPE that you were talking about, or in some cases, some other medical equipment that typically they had, but they were getting used so frequently, they were being burnt out. So,
Well, and I think even though our numbers are high in some of those homes, think what it had been had that proactive approach had not got taken. And
Exactly.
I think that's what we all have to understand.
And if you hadn't been able to, so there was a time when we had a nurse on here who talked about she was using the same gown 3 days in a row, and there was discussion among a lot of people about whether a trash bag with a hole cut in the top and arms would be sufficient for a gown. Now that it not only affects the health of the people who live at the congregate facility, but also the people who work there.
exactly.
And if you don't feel that you have the appropriate PPE, there were people who were deciding whether or not to go back to work at those
Exactly.
congregate care facilities, and that shortage of employees would be detrimental to being able to run a facility like that and keep it operating. So you can't discount the PPE issue, because it really not only kept people there, allowed them to work there and still protect their families and their own health, but it also allowed them to protect the health of the people in the facility.
And for a little while, we were having to think outside of the box and use some different options. And, we had looked for the opinion from some of our long-term care facilities for, if worse came to worse and, we needed to, use some unconventional forms of PPE. And, we were all on board. But thankfully, it seems, though, that has passed.
Yes.
And the PPE situation is under control. And as you said, thanks to our representatives and our local government, they've really stepped up to be able to get us that PPE that those long-term care facilities and our local hospitals need.
Yeah, I just wanted to give a shout out to the people who defended what you do, because there's always going to be some of the naysayers, but a lot of times they don't understand what goes on behind the scenes, and you and the health department have went above and beyond that. So
Oh, well, we're happy to do it, and
Thank you.
we do it all for the residents of St. Clair County, especially those that are in the long-term care facilities that need some extra help. So
Yeah.
we're happy to do it.
Okay. Next one. If I got tested today and was negative, but next week started having symptoms, can I be tested again?
Absolutely. We have several testing facilities that that do not require you to have any symptoms to be tested, and some of them do not even require appointments. So yes, you are free to be tested as many times as you would like.
Okay. Next one says, there is so much talk about tracing. It was reported our county got millions to do it, and I know of 2 people, one a family member and another a friend, who tested positive. They received a phone call, but nothing after that. Neither of them were staying home. What could be done about them not staying home?
So if anyone has any concerns about an individual that they know is COVID positive that they have seen out and about, please don't hesitate to contact us at the health department, and our number is 233-7703, and we will certainly check into the situation and see if any further action needs to be taken.
Okay. And one last one for you, Sam, here that came in. It says, Sam stated a couple days ago, maybe a week at tops, about a nursing home in Mascoutah with cases of COVID, but now that is no longer reported. Can you say what happened?
Sure. So, as we've said before, sometimes we receive inaccurate information, and that's exactly what had happened. We were given an incorrect address for this specific patient. We had been given an address where they previously resided, they no longer resided there. So the day that we did announce them, the following day we made the retraction and had stated that an incorrect address was given to us as a health department. And we certainly want to make those corrections because we take a great sense of pride in making sure that we provide the most up-to-date and the most accurate numbers. So if there is ever a mistake in a number that we report, we will certainly make that correction the next day.
Okay, thank you very much, Sam. Chairman, a couple more that came in. It says, it appears hospital numbers are below what you keep reporting, so why aren't we opening up like St. Louis is doing?
So hospital numbers are hospital numbers, and so we report the accurate number every day. I don't know what that means below what, but we are open in many ways. In phase 3, all retail's open. There are restrictions still on the bars and restaurants and certain large gatherings, but things are opening up, and largely this is moving. It's moving in that direction, and largely everything will open up on June 26th. So we just need to hang on and continue with the plan. We've got a couple weeks left, and we'll get to that point.
Okay. Next one says, has anyone given a thought to do mobile testing like other parts of the country are doing? There are many without transportation, such as public housing and elderly living, that should be tested.
So, in the last question that Sam, someone speculated about the amount of dollars that we got for tracking and tracing. That grant was finalized last week, and we'll be starting to access those dollars, and part of that will go for testing to where we go to locations where people are having trouble getting to get tested. We're going to take the testing to them, and that will happen in the near future. And there are several areas in the county where we believe there would be good candidates for us coming out to you to get tested. So that's all part of the health department plan. Barb Holt's working on that, and she's going to put it into effect, and it should be very successful. I think it has proven successful elsewhere.
Okay. We're joined by Susan Sarfati, the St. Clair County Superintendent of Schools. We had a couple school questions come in, Susan, as we usually do on these Sunday briefings. The first one says, can you address the opening guidance procedures for the upcoming school year, as we're due to start in about 2 months?
Well, I can. We are waiting for guidance from the State Board of Education. It's expected that will come out sometime this week. I do anticipate that we're going to be planning for several different scenarios: in-person learning, remote learning, and then blended learning, where maybe some students are not in attendance, they're at home, while others are in attendance. So we're looking at all different possibilities, and superintendents are beginning to talk and plan about what it will look like when we start back in August.
Well, that kind of leads into the second question here that came. It's a two-part question. It says, has the elementary and high schools in Belleville made a decision on if they will reopen in August? And if a parent doesn't feel comfortable, can they choose to keep their student home for e-learning? So it's kind of what you're reviewing now.
Right. No one has made the decision. We all want to be able to be in-person learning. It's what's best for children. It's what's best for parents who are working, whether they're working at home or they're working outside of the home. It's just what's best, and we certainly hope that we can have in-person learning. Has a decision been made yet? No, we're 2 months away. Think about where we were 2 months ago and how far we've come. And so if you look back and see the progress we've made, that's how much things could change by the time we go back to school in August.
Okay, well, thank you very much.
You're welcome.
Thank you.
Director, just a couple comments that came in. They didn't really have questions, but submitted into the portal, so I wanted to give you that information. The first one said, I've been following these briefings since day one. I've shared it with friends and families. I want to thank Chairman Kern and all those that took it serious and felt the people needed to be kept informed. It shows that we do have people in places to help care for us.
Well, very good. We appreciate those comments for those that sent that in, and we do it because it's the right thing to do.
Absolutely. Another one that said, I can't speak for everyone that follows these daily updates, but if I had a vote, you would get an A+ for all the work that's been done to keep the elderly citizens in the county informed.
Well, I'm sure we all love A+. Believe me. We made some blunders, but we'll take that compliment.
Next one says, now isn't the time to let our guard down. States all over are seeing record numbers. We've done okay so far, but let's not go backwards. Stay home if possible, wear a mask when you're out, and don't forget to wash those dirty hands.
Well, then it tells me somebody's been listening to us for the last 3 months if they're making that comment. So yes, social distancing, wash those dirty hands, and we're going to get through this.
Two more that came in, last two here. One said, you guys know this virus is never going away. We need to get back to normal as we do each year during the flu season. When was the last time the country shut down for the flu? Let's get this county opened.
Well, probably the last time, help me, the history bug.
This isn't the flu.
This isn't the flu. Everybody has said that.
I mean, this is a nefarious virus that has taken a lot of lives, and we haven't seen the number recently, but I mean, we know that our death rate is way up in St. Clair County, and it's largely it's going to be attributed to COVID. I mean, we're probably 100 deaths more than last year that can be directly attributed to COVID-19. So this isn't the flu.
And I don't know who asked that question. I really don't care, but that just kind of tells me that there are still a few of the naysayers out there. Because if it was one of their family members, they probably would not be asking that question. Like so many of them, we're up to 120 some deaths.
And if they're looking for history, look
Yes.
back at the Spanish flu
Yeah,
of
1918. Yeah.
and see what something like this causes.
And then we got one last one here. It says, I'm a proud member of Team St. Clair. From Chairman Kern and to each county resident that has realized the seriousness of this terrible disease. I personally lost a loved one to it, and even though that happened, the thought of how many more would have been lost if all of us wouldn't have stepped up and taken this to heart. Thank you to Team St. Clair for your dedication, and to all the people in our county, regardless of your opinion on this deadly virus.
Well, that's kind of just what I said. And first of all, sorry for the loss of your loved one. As the chairman said, the death rate, yes, one life is too many. And we're really sorry for yours, but we appreciate that comment. Team St. Clair was a phrase we were sitting around here one day and it just happened to come up. But every one of you who have embraced it and went out there and practiced the social distancing when you had to be out, wearing your face covering, spreading the word, spreading these briefings to your friends and families is definitely, I believe, got us to where we are now. We're just a couple of weeks away from phase 4, and boy, believe me, there's nobody more happier to that than us sitting here that's been here day after day looking at it. So please continue to do what we tell you. Sorry we're a little bit longer today, but Sundays are usually long. But the young ladies, Cindy and Daisy, will be back to translate this into our Spanish communities, and we'll be back tomorrow afternoon for the next update. Thank you.